Hello, good morning. My name is Piers French. I'm a Senior Strategist at Ashfield Healthcare Communications. Thank you for having me here today. It is my privilege to speak to you this morning about the importance of personalisation in healthcare communications and how it will help us all improve lives. Personalisation is one of the most important trends in healthcare communications. In the 6 years I've worked in healthcare, it has gathered increasing importance. I'm sure you'll be working on projects soon where this will be a key consideration. Today we'll discuss the need for personalisation, how Ashfield Healthcare Communications approaches this, and the need for future personalisation as we seek to improve lives and better support patients and healthcare professionals. But I'm going to start by talking to you about the reason we're all here today is the fact that it's an exciting time to be working in healthcare communications. So as you would have known, there's been a shift in approach from pharmaceutical companies. They're looking less at new blockbuster medicines and instead shifting towards rare diseases, which is great news for the patients who are affected by one of over 6,000 rare diseases documented. These patients are increasingly empowered. They're taking responsibility for their health. They're tracking their symptoms. They're researching their condition, and they're empowered to demand more from their HCP. At the same time, these HCPs are actually confronted by more scientific data. The discoveries that have been made requiring them to find out about new conditions and new diagnoses. So they have a great deal of challenges there. And it's important for us within the healthcare communications industry to provide this data in a way that is easy for them to understand, easy for them to interrogate, and easy for them to trust. These developments are quite daunting. So this is quite a challenging time to be a healthcare professional. And actually, it's our responsibility as a healthcare communications industry to actually provide them with information in a way that they want to receive it. And when we do this, there are 4 key challenges that I'd like to talk to you a little bit about today. One is the fact that when you start a task, much the same as we all do, we may start it on one device and finish it on another. So the things we create, the tools we create, the assets we create, all need to be available on multiple screens. There's a constant flow of information. The people in this room will be getting messages all the time, all the way they listen to this, and you at home will obviously be looking at this information as well. There's a fight for attention. People are always trying to compete to actually say that my messaging is the most important. And actually, when we look at our audience, and we've been talking about this a lot with personalisation, is that there's different professional needs depending upon who you are, even within the same profession. It's our role and our responsibility at AHC to provide this information in a way that they want to receive it. And that's why I think personalised healthcare learning and communications are incredibly important. So one of the things I'm going to talk to you about is about personalisation, and I'm sure that you are actually experiencing this in your everyday life. You'll be seeing this with emails which are targeted to you or maybe to your buying history. You'll be seeing this even if you read a storybook to a child. Often it's actually personalised to that person, or even if you created a card that's actually personalised for that birthday or that particular event. These things happen and you'll be able to see it in your everyday life. So what I've created, just to make this nice and simple for everyone to have a look at, is a scale of personalisation. So the first thing, as you see on the far left there, is insert your name here. You'll see a lot of communications which you've seen for years, which are personalised emails. There'll be things which actually almost customise just the way you communicate. It's the entry-level form of communication and personalisation. Then you look through where actually it's customised based upon your user behaviour, but it's still fairly basic and more customisation. What we'll be talking about where the true value is from healthcare communications is on the far end towards the right, where you're looking about more intuitive navigation which built around your needs, and you'll be also looking about personalised experiences. So this all seems a bit theoretical at this point, so I thought I'd give you a couple of great examples of your everyday life where you're seeing this already. So CocaCola is a brilliant example of this. So you would have seen these, bottles that are customised around with people's names. So Coca-Cola in 2014 put 1,000 different popular first names on their beverages, and people started buying them, and people started sharing them and gifting them. It's a nice little campaign, but it's actually had quite a big effect. So previously their sales were declining. After this, they were now 5% growth globally in sales. But that's more of the headline figure. The thing you really need to see about this are 2 facts, which I'm going to draw your attention to now. One, 730,000 people ordered personalised bottles online. This is a rare thing and quite an unusual thing, because Coca-Cola is ubiquitous. If you need a drink and you want one of those, you can walk outside to the canteen here, or you could be able to get one within 5 minutes. But people are actually ordering it. They're finding a value and a need for a specific version of the same product. Additionally, 17,000 people created virtual versions of it. So there's no product there. There's nothing to drink. There's no refreshing beverage. Instead, they just wanted to see their name and personalize that. The actual value is in the personalization. It isn't just in the fact that it's Coca-Cola. And when you look at this, you see that there is inherent value to this. What you can see more interestingly, and actually in the further end of that scale that I showed to you earlier, is Netflix. And that's providing you a personalized experience. What we all tend to think of ourselves is that we are all unique snowflakes. We are the kind of people that has all unique needs, and that we want to be treated accordingly. And to some extent, we're able to do that more with digital. Previously, you have an issue with a lot of content. So there are thousands of TV shows, films. It's quite overwhelming if you're given the option to see everything at once. So what the true value is in structuring that. So what an example like Netflix does is it actually structures that choice and allows you to have recommended content and personalized for you. So to put that truly in context, the guy here from Netflix was talking a lot about the different versions of Netflix. Essentially, there are 33 million US subscribers, and so to his mind, there are 33 million versions of Netflix. It's all personalized. The person sitting next to you in the audience won't have the same type of Netflix account as someone, one of their loved ones or their family members. It's all going to be different, and this is one of the opportunities with digital and one of the key learnings that we'll be taking into healthcare. So what I'm going to talk you through is a few examples of where we've looked at personalization in healthcare ourselves at AHC and our approach to personalized learning. So firstly, I want to talk to you about a project we did around Alzheimer's. One of the key things that we talk about with personalization is interactive storytelling. This is where you go into a narrative or a story and you direct your learning. We don't presuppose that you know everything. We also don't try and make you learn everything and go through in a linear process. What we're trying to do is allow you to explore the information you're most interested in. So this example here, which is living with Alzheimer's, this particular obviously condition, unless you're suffering from it, is really hard to understand. So what we're trying to do is generate empathy and try and help people. So for example, if you're a physician and you want to understand a little bit more of what the carer for someone or a patient is going through, then you have the opportunity to see the story and actually learn a lot more about this. So it allows you to explore this. Also, if you're a patient and you're trying to come to terms with how the physician's point of view and actually try to understand what they need to know, then this is actually a really good way of doing this. And it's one of the ways we're hoping to raise awareness and try to help people. Secondly is intuitive navigation, and it's a fancy way of essentially saying we provide you with the options you need based upon your preferences. So one of the things we're looking at increasingly is that we don't structure a website based purely on what you think everyone wants, but more customized to what you need. So we're looking about the idea of presenting choices to you in a way which is much more understandable, much more likely for you to click on them and actually engage with it, and also providing you with the content you need. So we'll be talking about how we get to this process, but we think this is an important step towards actually having a personalized learning journey. One of the case studies I want to talk to you today is about the Nestlė Nutrition Institute. So this is a client that we've worked with since 2011. We've helped them educate their global audience about nutrition science. And by global audience, it's an incredibly diverse audience. So they have a presence in a great number of countries and have 14 other websites, but we need to cater for their needs. So one of the things that we focus on increasing over the last 5 years is very much about the fact of understanding your audience. We don't presuppose that our audience back then is exactly the same as it is now, and we are constantly looking for more information. So what they've done and their strategy is constantly looked at this as well. So they're always looking at the audience behaviour, we're continuing to do research into them, and actually we're trying to innovate to find out new ways of doing this. This has culminated in us redesigning the website, which will be launched imminently actually, and the focus has been around personalisation. The focus has been on how we can better meet those individual needs. So one of the things we're looking at is providing a customized and personalized search that allows you to choose based upon your profession and what you're interested in, rather than requiring you to look at everything, and also actually looking more about recommended content. These are just the first steps that we're looking at. We're actually looking to see what more we can actually do to actually provide personalization, but it's definitely a clear structure and a clear path to what success looks like for us. A couple of things I want to draw your attention to, and what you'll be needing to look at if you consider this to be an important part of projects that you'll be working on going forward, is the distinction between limiting and freedom. So the beauty of personalization is it means it only provides you the things you need. However, at some point it presupposes what you think you need. So one of the things you need to look at, and why it's important to understand your audience, is the fact that if you're a nurse, it doesn't mean you only want to see things from a nurse's point of view. You are interested in your other professionals and what their perspectives are. So you need to understand the tension between obviously limiting people and providing them the freedom. So that is one thing we want to build in, and why we actually focus a lot on the audience insights when it comes to personalization. So the examples I've showed you are key ways of how we'd improve engagement using personalization, and what we'd build into a lot of our communication strategies. But how do we personalize? This seems a little bit more theoretical until you actually get into the nitty-gritty of how we do it. So I thought I'd talk to you a little bit about AHC's insight-led approach to this. Our focus is primarily on understanding our audience, so we try and segment them into different sections, and so we can actually appreciate their differing needs. Some of the things we look at are within their profession, what their experience is, what their awareness is around a certain subject matter. Because if you are an oncologist, it doesn't mean you know every single oncologist knows the exact same amount on a particular subject. So we need to make sure it reflects this. Also, we look at user behaviour and make sure that it reflects how they want to learn. Because every person has a different way of learning, and every person has a different way of approaching things. So we need to make sure that it isn't just a one-size-fits-all approach. We also look at the key drivers and the issues that they may face when it comes to disease education. We're trying to provide communications that actually suits their purpose, and therefore we need to go down to kind of the emotional and the needs-based approach to how they want to receive this information. To get to this stage, we use the entire breadth of our organisation. So we have really good partnerships with our clients to find out exactly what they know, because often they are really in tune to their patients and their physicians. They actually understand their community, that we just need to make sure we make the most of those insights. We combine them with our insights team, which allows us to do audience surveys and actually do face-to-face interviews to find out more about the patients, physicians, any other stakeholders that we need to work with. And also we have the experience within our company itself. So we have a wide range of people that we get to work with, often with really a great deal of experience in these particular conditions and these particular treatments, and we're keen to use this in kind of a multidisciplinary approach. And that's the key, I think, to working with us. Is one of the things is that it is a team effort. It only works well if we have everyone involved. So when it comes to actually creating some of the personalised experiences that I showed you before, it involves actually talking to scientists, scientific side of the team, the insights team, digital and creative, in order to bring this together. It couldn't work without everyone working towards the same end. So what is the future for personalisation? So it's far from certain, but we're sure of two things. One, that it's going to change, and if I was to present this talk to you in a year's time, I'm certain it'd be different. And secondly, it's an exciting time to look at and see communications in healthcare. One of the things you'll be seeing a lot is about machine learning and about different systems that allow you to actually understand and predict what people want. This is important. It's going to be something that's going to be increasingly more relevant in the projects you'll be working on in the future. But one of the things that we're clear about is the fact that it won't supersede the work we're already doing and the approach that we've already talked to you about today. In fact, it will just complement it. What we're looking at is that machine learning is a valuable tool that will help improve the experiences, but won't remove the need for us to actually have face-to-face contact, and that's the key to how we work and why we strive to include that in all the projects that we do. It's a valuable tool, but it's not the solution. One of the other things is around trust, and this is actually a theme throughout healthcare communications. So one of the things we want to talk about is the fact that personalization can be intrusive. If I if I go to a website and they know far too much about how I got to that place, the other places I've visited, it could feel quite intrusive and actually both damage the goodwill that may have been built up over time, or actually provide an actual negative user experience. So we're quite sensitive to the fact that the data shared from healthcare is actually something that we should treat with care, and we should actually focus on how we can provide personalisation in a more comforting way. To give you an idea of just how prevalent this issue is, 91% of people either agree or strongly agree in one of the recent studies by Pew Research that they have lost control of how their personal information is collected and used by companies. If we use it for personalisation in healthcare, we need to make sure that it's done in a transparent way and in a way that they can trust. So one of the things I'm keen to stress is actually personalisation, while important now, will only become more important. When I come to give presentations and when I come to advise companies around their creative strategy, branding strategy, or even digital, one of the things we're very aware of is how crowded the space is. We're very aware that the competitors are all striving to be the best that they can be, and given that, you need to find new ways of standing apart. And one of that is actually to provide the experiences that your audience needs. And so we think personalisation is a key way of doing that. Further, your expectations are increasing. You want more from these things. You don't expect it to just be flat text. You actually want it in a way that you actually can understand, interrogate, and engage with. And personalisation allows you to do that by taking the pain away from actually finding the information you need and providing it in that format. And also, digital opportunities. There's more information, there's new techniques that we can use, new tools that we can use, and these are always increasing. So there are new ways of us providing this that may be more engaging in a few years' time than we currently can. And I'd hope to talk to you in the future about different ways in which we can do personalisation and different ways we can approach this. So the key messages I'd like you to take away from my presentation today is threefold. Firstly, obviously, personalisation offers a great opportunity to improve lives. By supporting physicians and patients and carers much better and with more focus around their needs, we can actually help them improve lives and actually take some of the burden away there. Secondly, the way of doing that and achieving personalisation is a multidisciplinary approach. It's a team effort, and we rely upon the scientists, the digital, the creative, the insights teams in order to bring all these things together. And lastly, this isn't the end of a discussion around personalisation. This is only the beginning. What we want to talk to you about is it's very much an exciting time to work in healthcare, and it's a really exciting time to be involved in personalisation within healthcare communications. So for me, I just want to thank you, and thank you for listening to me today, and thank you for having me here to talk to you. I really appreciate it, and I look forward to speaking to you again.